Hello and welcome to this week's episode of the Montpelier Happy Hour here on WVEW 107.7 LP Brattleboro, your community radio station. I'm your host, Olga Peters, and this is the show where we talk about how everything in Montpelier shakes out for the rest of us. I want to welcome regular contributor and representative Emily Kornheiser. Hello, Emily.
Hello, Olga. Good to spend this time with you today.
Good to see you too. And welcome back to the show, Anne Sosin. So glad you can join us.
Hello, Olga. Hello, Emily. Thanks for having me on the show.
For folks who haven't met Anne before, Anne is a policy fellow at the Nelson A. Rockefeller Center for Public Policy and Social Sciences at Dartmouth College. And she is a public health expert and researcher. And thank you for coming back to the show during this COVID time again and again to just help explain this experience that we're all going through, Anna. We really appreciate it.
Thanks so much for inviting me virtually into your community.
Well, for the sake of our listeners, I'll just give them the big picture. When I reached out to Anne, I think last week, I did so after hearing a number of news reports about interviews with governors. Mostly I heard the ones throughout the Northeast, but I'm sure there are others, talking about how COVID is here to stay. And we need to stop thinking of it as a pandemic or a crisis and move into endemic planning. To which I said, is this the right time for that? Do we want to do that? Do we need to do that? What are the next best steps? What does endemic mean? So Anne, if you wouldn't mind jumping in and first just giving us a primer on what really does endemic mean in the context of a pandemic.
Wonderful, thank you. So let's start with a definition or what endemic doesn't mean. Many think that endemic means end of the pandemic, but really it means end or endemos, so in humans. And there are a lot of definitions of what it means for a threat to be endemic, but really basic level means that it's attached itself so permanently to us that we can't hope to eliminate it. And instead we have to think about how we control it over time. And really what our endemic future looks like depends as much on our policy choices and how we decide to control it as it does the nature of the virus itself.
Interesting. Thank you, Anne. So just in your experience as a public health researcher, do you feel that it's that given the course of COVID, that this is now the next logical step, or is it too soon, too late?
I think it's premature for us to declare this the end of the pandemic or to say that we've reached a stable state with the pandemic. We are just coming out of a surge that has resulted in more deaths than the Delta surge. As of now, we've seen widespread disruption of our critical institutions. And we know that these new variants and the surges that they drive are a hallmark of the pandemic. And so if we don't start to think about how we put in place the infrastructure to manage COVID moving forward, we can expect more disruption moving forward. And so our focus at this point in time really needs to be on how do we build the policy and public health infrastructure to manage this in a more sustainable way. And that doesn't mean ignoring COVID-19 or as a threat or hoping that we don't see another surge. It means it's really starting to prepare.
Okay. So, Anne, I guess I want to better understand what the difference is between preparing for the next surge or for repeated surges and preparing for it to be endemic.
Right. So when we think about something that's endemic, we know that we're going to be dealing with it over time. And that means putting in place the systems that we need to manage it. I think it would have been our hope that we could vaccinate our way out of the pandemic, and it would not be a persistent threat or something that would drive the types of surges that we've experienced. And so right now we need to think, how do we do our best so that it disrupts our lives, it results in less impacts on our health over time.
Mm-hmm. So as an example, speak to us of a virus or whatever that we consider endemic versus what we're doing now with COVID, just so we could kind of give listeners a compare and contrast context kind of thing.
When we think about COVID, what we're thinking about it is driving epidemics. So these, surges characterized by exponential growth of the virus over time. And endemic can mean a lot of different things, and there isn't really consensus on what that means. We know that malaria and cholera are endemic. HIV is now endemic. And so it really depends on the choices we make about how we manage it, how the resources that we invest in, where or what parts of the world or in what populations it concentrates in. And endemic diseases are often diseases of poverty. We know that the global burden of HIV, malaria, and tuberculosis is concentrated in lower and middle income countries. And we have to be really careful in the choices that we make, that we don't lay the groundwork for COVID-19 to become a disease of the poor and marginalized, both in our own country and globally.
Wow, that's pretty powerful. Wow. Okay. Thank you, Anne.
So when something's endemic, does that mean, if I think about my experiences working with HIV overseas, there would be surges, but they would generally be fairly small and localized. And so when something is is there, you mentioned exponential growth, is there sort of a difference between a disease that sort of regularly experiences exponential growth and one?
Well, COVID-19 is a little bit different from HIV because it's a respiratory virus.
It spreads much more easily.
It spreads very readily through shared air. And so because of the dynamics of transmission, how we think about it is a little bit different. That said, it's concentrated in many of the world's poorest countries. The trajectory of the pandemic is defined in many ways by who has access to treatment as well as to prevention. It's not something that we often think about in the US, but in the US as well, it concentrated among marginalized populations. So HIV has in many ways become a disease of poverty over time. And so we can think about COVID-19 in a similar way. Who's had access to vaccines globally? We know that there's that distribution has been characterized by stark inequities. There are sharp disparities in global access still. When we know those same disparities exist in access to treatment. And we also have to think about who has the tools to control both globally and in our own country. And those disparities are going to shape the future trajectory of COVID-19, whether we like it or not.
Mm-hmm. So are you feeling right now, or for Anne, what do you feel right now with COVID-19 as a society? What would be the best practices right now?
So there are a couple of things I'm thinking about. I think first, in terms of controlling the pandemic, we need to really build what I referred to before is the policy and public health infrastructure to manage COVID-19 on a sustainable basis. We need data-driven policies that turn on at the start of surges and then off again later. I've talked a lot about data-driven mask policies as being a primary tool to control the pandemic. We also need to be able to switch on the distribution of masks, tests, and other supplies, as well as social supports that enable people to access these tools and also comply with the public health measures that are in place. It's also really important for us at this phase of the pandemic to think about who's still vulnerable to COVID-19 and how do we enact equitable policies that don't concentrate the risks and burdens of the pandemic on most vulnerable groups. We know that in the US, there are 7 million people who are immunocompromised and can't benefit fully from the protection of vaccines. We know that children under 5 remain ineligible for vaccination. And so we need to think about how do we do our best to protect them or act in ways that don't disproportionately burden those groups as we look forward. So I think that that's a really critical thing that needs to be a focus of our attention at this particular moment. Looking forward, it's really important for us too to think about what are some of the innovations or the short-term protections that we put in place and how do we leverage them or build off of them as we look forward, both to address COVID and other health social challenges moving forward.
Mm-hmm.
So, Anne, I have a few questions based on that. One, I think about sort of what it means to sustain the public health infrastructure or turn things on and off. I think a lot about how in Vermont, most of the staff that have been responding either as, with testing capacity or vaccination capacity actually are folks with other jobs that they have really completely stepped away from for years now. And what that means both for their long-term job satisfaction and for the strength of our public health resources. And so when I look to, Olga and I must be reading different things because I've seen very little about New England governors and I've seen a lot about California's governor. And so I'm curious, Anne, when you read those, what do you imagine? And I'm going to actually ask about California specifically because it seems like it's a resource-rich place that sometimes actually does these things fairly well. And so what do you imagine that building sort of an endemic resistant infrastructure in a state like California might look like?
So California recognized early on that COVID was spread through shared air. And so it's employed mask policies in smart ways or ways that have often been smarter than what's been done in other parts of the country. But we also need to think about how do we upgrade our indoor air? How do we improve ventilation in public spaces? So we know that that's a critical tool that not only makes us more COVID resistant, but also will have benefits far beyond COVID. So that's one thing that I think about. When I think about testing, during this last surge, we finally saw the federal and state governments distributing rapid tests by mail. But what we really need is to have a distribution of tests at scale at the very start of surges. We should have large boxes of testing going out with priority to communities that are most at risk. And this is not something that should happen following a campaign of public pressure over the course of a month. But we need that in place early on. We might not have permanent testing sites in place, but we can have the distribution of tests ready to go when we start to see a surge.
Is it Ohio that has tests freely available at their libraries? It's one of the. There's a state right somewhere in the upper middle.
I don't know what Midwestern state that is.
Okay.
Or Connecticut. So another New England state distributed high quality masks and tests early in the Omicron surge, not perhaps in the quantity that we might want, but I think it was a good blueprint for what we'd like to see moving forward. But we should not be thinking about 2 tests or 2 test kits. We really need 40. We need enough that it's actually going to have a public health impact. And we need that to be done on time.
So, Anne, if we're all testing at home, how do we have data-driven decisions?
That's a really great question, and it's the subject of a lot of debate right now. There's a lot of discussion around whether we should still be counting cases and how do we count cases if there's a shift towards rapid testing. We're also seeing an increase in the use of wastewater for monitoring good COVID-19, and I think that's going to be a powerful tool. We have to pay attention to what communities have access to wastewater monitoring or are implementing that to make sure that we're actually picking up outbreaks as they emerge. Others are arguing that we should be looking primarily at hospitalizations. I tend not to agree that hospitalizations alone can guide our policymaking, just because it's for one reason that it's a lagging indicator, and so we're always going to be acting too late if we rely exclusively on hospitalizations. But there's a vigorous discussion right now about how do we, what's the way to do this going forward.
Would wastewater monitoring work in Vermont, where so few communities have wastewater systems?
Wastewater monitoring is already working in some of our larger communities in Vermont, but I do think that it could be a challenge in some of our rural communities where we don't have centralized waste systems. That said, I'm not an expert on wastewater monitoring, and so I do think that it's an example, though, of an area where we need to be attentive to rural communities and how these technologies are just deployed for disease control in them.
And then one other question I have from sort of that, something you said quite a few minutes ago that I had created this pile of questions for me was, when we think about sort of ongoing innovation in this space, I've been reading a lot about all of the progress that we've made on HIV/AIDS treatment because of how many resources were diverted to COVID treatment and prevention. And, it's been, 30, 40 years now that we've had activists and pushing for more research on HIV/AIDS. And as you said before, this has always been a sort of a disease, an epidemic of the marginalized and now of the poor, quite explicitly. And so what happened, right now we're able to divert so many financial resources, mostly because there's so much profit to be made with COVID research and treatment. And so what happens to the capacity for research and innovation and treatment if something does move towards this sort of endemic phase?
That's a real concern that we should be thinking about right now. To go back to HIV, antiretroviral therapy was available in the US in 1996. It wasn't until 2003 that the rest of the world began to have access to ART, and you can imagine how many people globally died while waiting for treatment access. And I think it's a powerful reminder that biomedical advances alone didn't propel some of the gains that we've seen globally around HIV. It was a movement of that brought together scientists and activists, to ensure access to them. And so, we need as much attention to developing the technologies to manage COVID-19 right now as to ensuring equitable global access to them. I think that there will continue to be innovation in the COVID-19 space because it continues to pose a threat to high-income countries. But we have to be really attentive to making sure that the rest of the world has access. And we're already seeing that much of the world has very poor access to vaccines right now, and there's a greater softening of political will to close those gaps. And I am very concerned, as that if the threat of COVID-19 recedes here, that there will be even less attention to global equity in management of COVID-19 looking forward.
Mhm.
And that doesn't just harm those folks overseas, which is a terrible thing, but it also is an opportunity for the virus to mutate because, right? Can you talk about that a little bit?
Exactly. Global vaccine inequity is a threat to all of us. It's not just a humanitarian concern, it's a concern for global health security. If we don't effectively vaccinate the world's populations, then we need to be concerned about the ongoing emergence of new variants. So it's really in our shared interest to redouble our efforts to achieve global vaccine equity.
So Emily, as a lawmaker, what's resonating for you right now based on what Anne has said?
I mean, frankly, as a lawmaker, a lot of what resonates for me about what Anne says is that some things are really best done at the federal level, and actually even sometimes best done at the global level, and how challenging it is to try to solve this problem at community levels, the way we had our town mask mandates, or even at the state level, given the sort of the capacity of our Department of Health and what they're able to do. And it also, it points to sort of one of the essential challenges in the way our democracy is set up, which is that legislatures and laws are not really designed to be responsive to emergent immediate needs. It's really where strong leadership in the form of, governors and presidents and administrative leads. It's where technocracy actually does have value, I guess I would say, which is not something I say very often. But I think, in states of emergency, that's our best case scenario, is really a deep politicized and empowered public health bureaucracy, which we haven't had in the US for a very long time.
Mm-hmm.
Yeah, if I may comment on that.
Yeah.
I think, since the start of the pandemic, we've seen an absence of federal leadership. We don't have to sort of chronicle what happened under the Trump administration, but we're well aware of the deficits of federal or national leadership in managing the pandemic. And I think many of us had hoped last year when President Biden came into office with a much praised pandemic plan that we'd see a real shift in strategy. He had a very comprehensive plan for controlling the pandemic and really promised to drive science and equity through the response. But the administration has really never fully implemented many core elements of the plan. And what's happened is at state level, we've seen a fragmentation of responses. We haven't had clear federal policy guidance to shape action at state and local levels. We have often, or we've seen states take very different approaches in absence of clear policy guidance. Much of the action has happened at a very local level. And I think that that's generated inequities across many of our communities. If we can take the case of Vermont, the absence of clear federal policy guidance and state policies in this latter part of the pandemic has led to a very wide range of responses within our communities and also within our schools, which have been a focal point of this phase of the pandemic.
Okay. Interesting. We have just about 5 minutes before we have to go and hear from some of our underwriters. So I just want to touch base and see if there's any strings you kind of want to tie up in a bow, and before we move to the second half, or Emily, I just want to give you that chance to do that. No?
I don't think I have anything to add right now. And I know you have more questions waiting for me after the break.
I do. And I will just say, rather selfishly, that going into this conversation, I was feeling a little disheartened by some of the conversations around going into endemic planning, just on what I'm reading in the news reports, in part because I feel like we've worked so hard. I guess I was hoping definitely on a local level, but on a societal level, that we would be further ahead with this pandemic, that the numbers would be lower, that we'd be seeing fewer, if no surges, that fewer people would be getting sick. And I guess I'm feeling a little disappointed that it does feel like some folks are right. They're just like, we're just moving on, folks, is how it comes across to me a little bit sometimes. And so I'm just sharing that kind of sense of disappointment right now, even though I acknowledge that a lot of people have very deep COVID fatigue, which is a thing as well.
Yeah, it's funny. We worked really hard, but we didn't really work very hard together. And so, there's only so much you can do when you're working hard on your own or just with like your immediate people.
Well, I think that's a good point, Emily. And the conversations now are also not really working together.
No, they're not.
Yeah.
It's it sort of surprises me how tired people are of masks. I don't really mind my mask that much, and I'm wearing it like 10 hours a day right now, and I just don't really get it. And though I'm like a fairly sensitive person about like my skin and sensory stuff and sound and communication and overstimulation, but like my kid told me I'd get used to it, and he was right. I don't know.
I actually, if you look at the polling data on masks, what we see is that while people are tired of the pandemic, I think we're all tired of the pandemic, there's wide public support for masking and mask mandates or mask policies. And so I think two things can be true. We can both be really fatigued with the pandemic, but we also can recognize that we need masks as part of our toolkit to control it. I think, we all look forward to a time when we can see smiles again, and, don't need masks in all of our public spaces. But we're not there yet. Mm-hmm. And most of us recognize that, I think.
Yeah. Well, and Sosin, sorry, Emily, want to say something quickly before?
I was going to share, I sort of, noticed this interesting thing in Brattleboro where we've, had our mask rules in place for quite a while and, are fairly committed to them, is that in downtown, it's very, very maskful. And the second you go to any of the businesses on the edge of town in our strip mall, there's no masking at all. And it's just like, culture is amazing. So maybe that's part of the conversation after the break.
I stopped by my office for my day job the other day, and when I last was there, because many of us are working remotely, it was everybody has to wear a mask when you're in the building, and people have kind of let that go a little bit. And when I visited on Thursday, I was the only one with a mask in the building because I was still kind of trained to keep wearing mine in the building. We should hear from some of our underwriters here on WVEW 107.7 LP Brattleboro. So stay tuned. The Montpelier Happy Hour will be right back. Hello, beautiful people, and welcome back to the second half of the Montpelier Happy Hour here on WVEW 107.7 LP Brattleboro, your community radio station. As always, you can also find the Happy Hour on BCTV, as well as our Montpelier Happy Hour.captivate.fm page, Apple Podcasts, and pretty much anywhere you find podcasts. You can also find us there, and our Facebook page, the Montpelier Happy Hour, in case you've forgotten our name. If you are just joining us, we are speaking with public health expert and researcher Ann Sosin, who is coming to us, well, I think from her living room, but normally would be coming to us from Dartmouth College. Thank you so much, Anne, for joining us today. And Emily Kornheiser, one of 3 reps for the town of Brattleboro, is also with us. So Emily, what do we need to remind our listeners of?
We need to remind our listeners that the views and opinions expressed here on the Montpelier Happy Hour are those of the host and the guests separately, and not those of the radio station or the TV station or any of the platforms they have broadcasted on, or any of the employers of any of the people who might be talking to us. I would also like to remind listeners, or just apologize to listeners, for our temporary podcast uploading snafu. We think we're caught back up now. So even though you had to go quite a few weeks with no Montpelier Happy Hour in your feed, you now get to have all this fun catch-up time and just binge the happy hour.
Yes, make yourself a good pot of coffee or tea or cocktail. We highly recommend all the above, and catch up. And again, yes, thank you, Emily, for reminding listeners of our technical difficulties. So, Anne, talk to us about some of the lessons learned from COVID, and how can they teach us about COVID, about going forward, and about public health in general?
Let me start with one, which is, I think we've all learned how much of our health is produced outside of healthcare systems. I think going into the pandemic, we thought about health as being the province of our healthcare system, something that was really the focus of physicians and nurses and other healthcare providers. And we've all learned that much of our health relies on what happens outside of there. It's the places we live, work, the air we breathe, the things that we do that have a tremendous influence on our health. And moving forward, we think about the ways that what we often call the social determinants of health influence our health, and how we what are the ways that we can act on those other factors that shape our health. So that, I hope, is a first lesson. And to bring that back to COVID-19, we only had vaccines last year, or I guess it's been more than a year now. Before that, we were really reliant on community action, or what we call non-pharmaceutical interventions. And I hope that we, as we look ahead, we'll remember that community action and those other things that we do, and the things that reside outside of our health system, are really important. So I hope that that's one lesson that we learned. I think the second thing that I hope that we start to understand is that inequity is a threat to population health. With COVID-19, we've seen that the virus thrives in crowded living and working conditions, and that if we don't have focused attention on places and groups that are most at risk, that puts the health of all of us at risk. Let me take an example for you. When we know that prisons are a place where COVID-19 is spread really readily. We have, it's a congregate living setting where inmates share air. And when we see an introduction of the virus in those settings, it spreads rapidly, but then it spills over into our communities. And when we see from data that's been collected from different settings in the US, that that prisons contribute to community spread. And so what I hope our learning will be is that when we address or we target resources to populations and groups that are most at risk, we not only can reduce disparities that we see in health outcomes, but it also has benefits for all of us in our communities. So that's a second lesson that I hope we'll take. I think a third lesson is that we've seen a number of creative adaptations. We've seen the expansion of telehealth to deliver care. I hope that that we preserve that and recognize that that is important way, not only to continue to deliver care, but to address gaps in access to care, particularly in our rural settings. We've seen groups of people that have had better access to care, but not only to care, but also to education and to work as a result of some of the rapid transformations we've seen in the way that we do things. So I hope that instead of rushing back to pre-pandemic normalcy, we'll really examine what are the things that we want to preserve and sustain in our post-pandemic world.
Thank you. How about you, Emily? What are some of the lessons you're sitting with, or even your outstanding questions still?
Well, I think I remember talking about the social indicators of health in policy-making circles a few years ago, and it was really a lot of work to get people's heads around them. And now it feels like it is a little less work to get people's heads around them, and now we need to act on them. And one thing that I think we've learned from the pandemic is that we can act quickly when we need to. And so I hope that we can maintain that faith in our ability to sort of rally around an action when needed. The interrelatedness of our health, I think, is a really powerful one, Anne, and I appreciate you bringing that up, and how much each of our well-being is very explicitly dependent on other people's well-being in our own communities as well as across the world. And so while I think we are all so overwhelmed right now still and really like traumatized right now, I hope that as we move through that, we can retain that like real visceral understanding of that interconnectedness. And then the last one that you touched on, and I'd love to dive more into, is this idea that we made a huge number of shifts in what was possible for how we connect with each other, that I think were really valuable for folks who might, on a day-to-day basis, have a harder time accessing public spaces. And so that's folks with chronic health issues who might need to be sort of physically at rest more often. It's parents of young children who can't haul the whole family out to go to a 1-hour meeting. There's a whole lot of people in our communities. It's elderly folks. It's a whole lot in the winter. It's a whole lot of folks in our communities who really, really benefited from Zoom. And from Zoom meetings and from having events broadcast into their homes. And while there are pieces of that I think certainly exacerbate isolation, they also really create a lot of opportunities for connection. And so I hope that as we more of us move back into being in person with each other, we don't just half-ass the public access part of what we're doing. So I know, for example, when the legislature was entirely virtual, we were all in our little Zoom boxes, and that was what was on YouTube. And we've made this huge step forward in access by putting cameras in all of our committee rooms so that we can still stay on YouTube. But the picture of my little face is pretty small now if you watch me on YouTube. And I've heard from a lot of folks who watch our testimony that it's hard to tell who's saying what, because the cameras aren't very dynamic. And so what was a real great step forward in transparency, we've sort of tried to keep up with, but I think we've lost some of the attention there. And so that's another piece that I'm hoping we can stay focused on.
Mm-hmm. Thank you.
I guess I would add one thing there, which is thinking about the ways in which the virtual world has become more accessible to some groups, particularly people living with disabilities who may have had more limited access for a variety of reasons. Some of our students said that moving to a virtual platform has enabled them to participate much more fully, in the learning environment. And so I hope that we really think about it, not only how has this opened up our world, but how has it made it more accessible and equitable? And then think about what is it that we really want to preserve in all of that as we move forward.
Mm-hmm. Yeah. Mm-hmm. Thank you, Anne. Talk to us about some of the specific steps we should be taking now, thinking primarily for vulnerable groups or school. There's been a lot of talk about schools lately. So if we could start with the school system, and what are some good practices right at this point in time?
Sure. Let me start with the question about schools, and then maybe we can take the question about vulnerable people separately.
Perfect.
So um, we've made great progress in our state in continuing vaccination programs, but it's really important for us to continue to maintain the mitigation strategies that we have in place to ensure that our schools remain not only safe, but also stable for in-person learning. We've seen widespread disruption of our schools over the last several months. It's only intensified with the Omicron surge, and we really want to do everything we can to ensure that we don't reverse the progress that we've made over the last couple of weeks as we've started to come out of that surge. And so that means maintaining masking policies and other mitigation strategies until we get to a better place. It also means continuing to close gaps in vaccination. Although we're more vaccinated than other states, we still haven't achieved the vaccination levels that we need in children. And we see disparities across our state. Some counties are much more vaccinated than other counties. And the other thing that we need to keep central in our thinking is who in our communities remains vulnerable right now. And the mitigation strategies that we have in place in our schools protects those members of our school communities as well as people who are at high risk in our broader communities. And we can talk a little bit more about that.
Let's talk a little more about that.
Yeah.
Sure. As I mentioned earlier in the conversation, 7 million Americans are immunocompromised, and many of them can't benefit fully from the protection of vaccination. And we have new therapeutics that are coming online that will provide added protection for some people, but we know that supply of those treatments remains scarce, and that there are challenges in access. And so we need to go back to thinking about how do we as a community protect those members of our community that are most at risk. And that means employing mitigation strategies, so layered approaches to mitigation in our public spaces. We also know that children under 5 can't yet be eligible for vaccination. And while many of us might think, well, most of the school-aged children now are protected, and the educators that are working with them are protected. What we sometimes forget is that there are vulnerable people both in and linked to our school communities, and that those other measures that we take help to protect them right now. We know that there are educators and families with young children who can't be vaccinated. We also know that there are high-risk educators or those who share households with them. And so we really need to continue to think of the pandemic as a collective or community problem rather than rather than one that just that is an individual problem.
Anne, you mentioned taking layered approaches to protecting our public spaces, and I think you touched on it a little bit in the first half, but I'd love it if you could just give examples to help people understand that. Like, what would a layered approach look like?
Right. We often look at the Swiss cheese model, which shows different layers of protection, and that those layers include vaccination, but we also think about masking and testing and quarantine and isolation, and the social supports that we employ, all as being part of the many layers of protection. And we know that these layers work best in combination with one another and not in isolation. And we know that they're best deployed as a community rather than at an individual level.
Why is it called the Swiss cheese method? I'm so confused about that metaphor.
Because we know that any one layer has holes in it, like a piece of Swiss cheese. But when we layer those pieces on, there's much less likely that we'll see a breakdown in the protections that we have in place.
If a
So
whole doesn't go through the whole block of cheese, it's in different places. Thank you.
Yeah.
For that one.
Love it.
Our real concern is that, as many of us are individually at lower risk, we have more protection from vaccination and now from infection as well, that we start to forget about who's least or who is most at risk or continues to be at risk, and we concentrate risk and burden on them. And it's really important for us to think to really think about how do we continue to sustain those layers of protection in ways that don't concentrate risk on many in our communities.
Are there policies, sorry, Emily, just quickly, are there policies or practices happening right now, particularly in regards to COVID, but if there's another public health issue you want to touch on, that is an example of concentrating burden on the most vulnerable, as you just mentioned?
Let me talk about something that's being proposed right now in the context of the conversation around schools and why I think it's the wrong approach. So many are suggesting that we should roll back mask mandates in school settings and that we should rely on one-way masking to protect vulnerable people. We know that masking is most effective when it's done by everyone, that universal masking confers greater protection on everyone, including those who might not be able to mask or mask effectively in our communities. But I also worry that resorting to one-way masking also can be highly stigmatizing of people with a chronic illness or at higher risk. Many people in our communities have invisible illnesses or disabilities, and so masking is one way that they might be identified. And I worry that there would be other social consequences for those that are masking it. I'm concerned that some young people would be forced to choose between revealing an illness and conforming to the social norms in their community, which may not support masking. And so I think that that's really a misguided approach and one that really erodes the sense of solidarity and collective response that we need.
Thank you, Anne. Sorry, Emily, I interrupted you just.
No. I mean, I don't know if I was interrupting. I think we were having mutual moments of speech. It's interesting sort of in that context of thinking about our most vulnerable. I find in my own household, my son has a friend who lives with both of his grandparents who are both quite medically vulnerable, and how helpful it is to have to be mindful of this boy and his family situation when we're talking about what we're doing as a household. That awareness of someone who's medically vulnerable in not even our direct circle, but our indirect circle, really helps us make sure that we're making the most appropriate decisions around sort of doing a rapid test before going for a long drive in the car together or something like that, for my son and his friend. And it really helps sort of reinforce all of the existing best practices that we know that are there, which at this point in the pandemic, sometimes, we see other people maybe not doing them, or it starts to feel like I've been doing this for so long and I haven't seen a direct result. So maybe I shouldn't, continue on with this. So that's been a really, it's been an interesting way that we've navigated it. It's like with this really direct awareness of these folks in our lives. And I wonder if from sort of a public health communication perspective, it might be helpful for more of us to get more in touch with the folks in our community who really need us to be thinking about them.
Yeah, I think it's really important that we rehumanize the narrative around this, because oftentimes it's framed around overcautious people.
Mm-hmm.
And we forget that vulnerable people are threaded through our lives. There are teachers, there are coworkers, there are family members, and are, just as our lives depend on them. Their lives depend on us. And we really need to hear those stories come out and to recognize that, our health is interconnected, our lives are interconnected. And so I agree with that. And I also think we need really, strong policy advocacy to ensure that the choices that we make right now don't disproportionately burden them. And one way that I often think about this is that we should continue to rigorously mitigate all of our essential settings, and that includes our workplaces, our schools, and other places that people need to access to meet their basic needs. I focus a lot less on recreational activities or social activities. I think we're past a point in the pandemic where we're going to impose restrictions on those types of things, but we do need to ensure, especially when we're in surges, that everyone can continue to meet their basic needs in the safest way possible.
Yeah, I remember when we were first talking about the masks in schools and that it was guidance rather than a mandate. And there was a lot of talk from the administration about, well, it's just one school in just one district, that's not doing this. And I have a good friend who is parenting an immune compromised kid in that school district. And so yeah, it's just one school, but there are kids in that school and families in that school and vulnerable people in that school. And so just the idea of just sort of throwing out the health and safety of that one town is just, it's wild to me that felt like an option for people.
Yeah, I've come to understand that mandates equal equity. They protect everyone, and they ensure that everyone has the political, technical, and material resources to protect themselves and the communities around them. We know that better resourced communities are in a much better position to implement some of these measures. And it's really the places that have much more or less in the way of resources get left behind. And so while many in a community like that may not be particularly supportive of mask policies, having a mandate that comes down helps to protect those vulnerable members of those communities, even in the absence of broad public support for those measures. And so I think of that as something or the absence of a mandate is something that really concentrates risk and burden on families like the one that you're describing. It might not be important to most, but it's incredibly important to those that really need those protections in place.
So well said. Thank you.
I think one thing that's, and just for listeners, there's some noise happening in my building, so if you can hear it, I apologize. I think what astounds me about the pandemic over and over again is how often we compartmentalize everything, society, borders, whatever, but this sense that, well, it's only one school in one district, but that school is still a community and communities touch each other. Or folks who live, this happened, I think, a lot between Vermont and New Hampshire. You live in Vermont, you work in New Hampshire, or vice versa, and you've got different mandates or different rules you have to follow. But there's this sense that the COVID will stop at the border somehow. And I keep coming back to that and just being astounded by that piece of human nature sometimes. I'm wondering, Anne, do you see that in your work? Do you see people kind of compartmentalizing things like that?
Definitely. I live in a border community, and so I cross the border multiple times a day, and everyone around me does as well. And viruses don't respect those boundaries. We live, learn, work, and play across town and state lines. And so we need public health measures that transcends those boundaries as well.
We are just about out of time, so I want to touch base with Emily and Anne. Is there anything you want to leave listeners with before we head out?
No, I think Anne had a mic drop moment with that, talking about how mandates create and reinforce equity. And so that is the thought that I want us to sort of sit with, because it is such a think it's a flip in thinking for a lot of folks.
Mm-hmm. Thank you. Yeah, thank you for that, Anne. Anne, anything you want to leave listeners with?
I don't think I have anything to add.
Well, as always, since this COVID and public health is ongoing, we hope you can come back to the show again in the future. If folks want to check out some good resources on public health, learn more about the work you do or at Dartmouth College, where can they go?
I have a bio on my center's site at the Rockefeller Center at Dartmouth, and you can access some of the other things that I've written and done online. I've written a number of opinion pieces, both in the Vermont press as well as in the national press.
Thank you, Anne. Emily, where can folks find more information about you?
If you go to emilykornheiser.org, you can find links to my email and my phone number and my weekly office hours, as well as on my blog tab, you can find my weekly newsletter.
Fantastic. As always, you can find the Montpelier Happy Hour on WVED 107.7 LP Brattleboro, your community radio station. And Emily, what should we toast to today?
Every week when I get home from Montpelier, there is a new flower blooming in one of my indoor plants. And I think it's a metaphor for something. I'm not sure exactly what it's a metaphor for, but I want to toast to whatever it means.
Cheers. Thank you. Hey, everyone, we will be back next week. So looking forward to you joining us again. Take care.